To begin, locate the electrode headset box and remove a headset package. Each headset package contains instructions for application, alcohol wipes, and a skin prep pad. Utilizing the Quick Start Guide, follow the steps to power on the device, enter the operator ID and password, and enter the required patient information. As a reminder, the data collected must be accurate, and date of birth accuracy is critical. Press Start EEG on the Information Hub to review the on-screen skin prep and headset application instructions. Prepare to apply the headset to the patient. The patient's skin is prepped prior to the placement of the BrainScope 1 headset. Using alcohol wipe pads to remove dirt, oil, or makeup, clean the entire forehead and earlobes. Using the skin prep pad, use 2 fingers and apply firm pressure to exfoliate the skin. Begin with 2 swipes just below the hairline down to the bridge of the nose. Then, 2 swipes just above the eyebrows. Repeat with 2 swipes over the temples and earlobes. Before placing the headset, align the lower edge of the nose tab with the bridge of the patient's nose. Check to be sure the top center electrode, C1, will fall below the hairline. Remove the cover backing from the center electrodes, C1 and C2, and apply the electrodes, making sure the headset is centered. Ensure that they are firmly affixed to the skin by pressing down on the electrode. Hook the headset over the ears. Remove the cover backing from the L1 and R1 electrodes. Ensure that the electrode falls just above the eyebrow bone and firmly affix it to the skin by pressing down on the electrode. Apply the remaining electrodes, L2 and R2 on the temples, and L3 and R3 on the earlobes. When placing the electrodes on the earlobes, be sure to bend the tab back to firmly secure the electrode. Place the EEG module on top of the patient's head and connect the headset to the module. Be sure to insert the headset connector straight and level into the EEG module port. The impedance screen will display the electrical impedance from all electrodes to assure good quality signals prior to collecting the EEG data. Press the Begin button when sufficient clean data to calculate a result has been collected, usually in 5 minutes. The device will calculate and display the result. To perform the cognitive performance tests, press the Start button on the Brain Information Hub. Hand the BrainScope 1 device to the patient. The patient reads the instructions and follows the directions to take the tests.